So I'm here with Anne Taylor. Anne, would you like to just introduce yourself to those people that are going to be watching the video?
Okay, my name is Anne Taylor, and I am an advanced clinical massage and sports therapist and a cranial sacral therapist as well.
Okay, so for those people that might not know, Anne, whereabouts are you based?
I'm based on Victoria Street in Morecambe, number 33.
So that is literally almost a street behind the prom, isn't it, on the central area?
Yes, it is. Yeah,
okay.
yeah.
So I think quite a lot of people will recognise you when they watch this video. But in terms of, I suppose it's difficult to say the services that you provide, but if you can give a bit of a general view of what is it that you do at your practice?
I treat people who are suffering with chronic pain, acute pain, sports injuries, niggles, and pain like that. You know, when you get that niggly pain, or if you've got a chronic pain, especially if you've had it for quite a while, and acute pain as well, like if you go over on your ankle and your foot's swollen, I deal with that as well.
So just for those people that are watching, because often people do put up with niggles, don't they? So in your terminology as a professional, what's the time scaling in terms of what is a niggling pain? When does it become acute? Or when does it become chronic? Just so people can understand that differentiation.
Okay. So when you have an injury or you've got a niggle, you've done something. And sometimes you know what you've done, and sometimes you don't know what you've done. So if that niggle, you keep hold of it, I keep saying, don't hold on to stuff. If you keep hold of it and you try and ignore it, the time then lengthens.
Yeah.
So that will go, the time will lengthen, and it'll be about 6 weeks or more down the line where I say, oh, this is getting worse. And after 6 weeks, that's when it turns chronic. So when it turns chronic, for me, it takes longer to recover. So with an acute pain, it's when you've literally gone over on your ankle, or you've done something and you've gone, whoa, that's really, really hurt, and it gets swollen and it's red. You don't do anything about it, and yeah, you might put some ice on it, but you don't repair the underlying tissues, because the underlying tissues have been damaged, and sometimes you need to repair. You need some help to repair that, because the underlying tissue can be scars,
right.
And I break down the scars to lay them flat, so then you can get your strength back. So if you wait over 6 weeks, at 6 weeks it's turned chronic.
Right. And that's where it's just going to take much. It's not impossible to resolve, but it's just going to take longer to resolve.
No, it just takes longer. If you've kept hold of it more than 6 weeks, it takes longer to resolve.
Okay.
And it's not a one job and done. No, you need to come in for a series of sessions them sessions will take, you'll have more sessions for it to recover.
Okay. So obviously you've gone through a bit of a turbulent time, as a lot of business owners have, and particularly independent business owners, because you've not been able to practice physically, but you have been doing some stuff for your clients and online, haven't you, though?
Yes, I have. Yeah. I did at the beginning of the first lockdown. I went on a course to take my practice online, and I've done a couple of 2 or 3 clients that have come online, and I do like a joint assessment online, and I've given them homework to do, specific homework to do. But I know that these people need, I need to get them in, but I couldn't get them in. So when I opened in July, was it June, July? I thought it was a relief just to get these people in. and they've stayed with me, we just like have a one-to-one online and say how you doing, and and they'll say, can I book in next week? Want to book in next week? I need to see you.
So you've been almost maintaining them and pretty much making sure that they've kept up with the homework.
Yes.
Because people do come for treatment, don't they? And I'm guilty of this. They'll come for the treatment and think, oh, I feel better. And then we kind of slowly forget to do the stuff that you've told us to. And then we're surprised when it arises again. So even when you're in practice normally, you send everybody away, don't you? More often than not, with things to do at home to help speed up and aid the recovery.
Yeah. Because I keep saying to my clients, it's not what I do. When you first come to see me, I try and sort out the tissue from it being really, really tight to relaxing a bit, but it's then the client's participation in the home care advice to lengthen that tissue. So you need to do some work, or you need to strengthen it. Yeah, they need to stretch it or strengthen it. So, and also it's about self-care as well. It's about self-care as well. So if sometimes I like I'm fighting with them with that, but also if they're if the client's in a job that takes a lot of strength, I'm fighting the job as well.
Right.
So there's a lot of things that can come into that as well, but it's not what I do, it's what the client does at home in between. Because those that do the work, when they come and see me again, I go, oh, okay, what do I do? Do I bring them in again next week, or do we push it for 2 weeks, or shall we try 3 weeks?
So I suppose, like any good teacher, you'll know when someone hasn't done the homework.
Oh, definitely. Oh, yes.
So, so obviously we've got some good news, so that, with now that some of the restrictions being lifted, even though we're tier 3, that one-to-one work can continue. And I know also, because of the strength of your qualifications, you actually had potentially been able to operate even in the last lockdown in person, because you were classed as almost that medical need and medical service, weren't you, as well? I know you were debating whether or not you did, but luckily that's no longer an issue because you are able to anyway. But so what's changed? So you're able to see people in clinic now, but there are some slight changes, aren't there, about how that now operates?
Yeah, I still have to do online assessments, okay, and when I do bring them into clinic, I still have to reduce the contact time that I have with them in clinic to it's to reduce the transmission and whatever. I'm still cleaning after every client. I'm still changing the linens after every client, and I have to do my ventilation. I have to keep my door open for 30 minutes after every client as well. So I'm not bringing in a lot of clients in one day, so that has reduced down. And I'm putting 45 minutes in between clients, so then I can do my paperwork and my cleaning and my ventilation.
So there's no chance of anybody passing anybody when they come to see you, are they? It is literally one in,
one in,
space
one
and a
out.
gap, one out, one in, one out. Okay, okay.
Yeah.
So when people then contact you, so you're saying that the first step is, because you like to have a phone conversation with people, really, don't you? First, to understand.
I do. So then I can then assess if I can help them, and if I can't, I try and refer them to somebody else.
Okay.
But I do try and get them in with me, because some of them are quite desperate, especially those that are trying to get to see a GP or somebody else. I'm sort of the last resort, really.
And you are also somebody that people come to when they've also exhausted all those other options, aren't you? Because
yeah,
I think it's worth us explaining that you have a toolkit that's about a mile wide in terms of your experience and expertise. Because you started off, didn't you, in a clinical medical setting, didn't you, as well, many
yes,
years ago?
Yeah, I was a nurse for quite a while, in the operating theatre nurse. Yeah, so everything that I've done from then is like added on to that, and also during lockdown I've had to like fall back on that as well for my cleaning, because my room's split into two. One's my working area and one's my like. I've had to split the upper half into a dirty and a clean area. It's not dirty.
Yeah.
It's where all my it's where all my cleaning stuff is. That's what we call dirty.
Yeah. So that is really going back to your to the old discipline of being in operating theatres, isn't it, as well?
Yeah, and also because of that, I was one of the last ones to be brought up with matrons in them days, and they were really strict. So it never leaves you. Never leaves you.
Sounds more like the fear of God, to be honest. So were your matrons in the days where they were wearing they were, right? Okay, as we really do remember them in those. Yeah, they were the matriarchs,
hospital corners for beds. Yeah, and if it wasn't right, you had to do the bed again. Wow.
So obviously, but people will associate that when they are in pain, like you say, whether it's a niggle, whether it's acute, whether it's chronic, you're somebody that they're going to come and see, and you'll work with them to reduce their pain in the fastest possible time. But there's a caveat around the client needs to do their piece of that. Yeah. But then you do other stuff. So you do scar work, don't you? And think, I don't know if people really understand scar work's not just the superficial scar. It's the things associated with that. For someone who knows nothing about that, could you give us a simple also explanation as to what that is? Ish.
Yeah, it's your scar can look nice on the outside, but you've been cut through more than one layer. It's more than your skin. It's gone through muscle. It's gone through other tissue as well, and it's the underlying tissue that can get like this. It's really, really tight, and when that is tight, it pulls other tissue in another part of the body. So it can go, say if you've got a C-section scar, that can transfer up into your neck. It can transfer to your jaw, or it can go right down to your ankle or your thigh, because the tissue underneath it's like it's like, you know, when you go past a net curtain and you just ruckle it, and then it ruckles over the top. That's what's going underneath your scar.
So it's almost repaired as best it can, but that repair isn't in the form it would have had once, with that flexibility and movement that would have been in it.
So with that ruckling, you're getting tightness of your tissue, but that will transfer up into your neck, your jaw, down into your ankles. So yeah, so it's just about me feeling that and listening to the tissue and just following it and just releasing it. So when I do scar work, I don't work immediately on the scar. I go away from the scar, so then I can release all that tissue, so then I can work on the scar.
So for fact, there's a common thing, isn't there? So when ladies have had cesareans, they'll have a bad back. They can't sit very straight for very long, or they find being sat, I don't know, on a hard surface quite painful, or the bottom of the band of the back starts to give them, you know, not acute pain, but I'm speaking from experience here. It starts to be, it interferes with your comfort, I suppose, is probably the other way to put it. And you can help release that. I mean, I know that's one example. There's plenty of them, but
there's loads. Yeah, it's just one example. Yeah.
And then there are other things that you do. So when we talk about TMJ, isn't it? Is it TMJ? Is that right?
Yeah, I'm a level 2 TMJ with blend therapy. It's a trademarked course, and yeah, I'm trained in TMJ as well. A lot of around the jawline, up into the TMJ, up the head, and also it's neck and shoulder as well.
And
But
what do people experience if they've got a problem with what if someone's watching this and they think, oh, that sounds like me? What are they going to be experiencing in terms of movement or lack of, or pain wise? What kind of thing do they feel?
headache, migraines,
Okay.
Tinnitus.
Really? And they could all
Yeah.
be part of, and how does that form? What's been the catalyst for that starting to occur? Is there a common theme, or is it?
No, I think it can be anything. But even especially during lockdown, you might not realise, but you could be clenching your jaw.
Right.
Because I've been doing that recently. I went, oh, I've been clenching my jaw. Yes. So even just clenching your jaw, or if you're eating, you might be hearing a click from your jaw.
Yeah. Yeah.
And if you're yawning, you can hear a click in your jaw as well. And
so they're all things that could be part of that
of TMJ.
So things like people that might be grinding the teeth in their sleep and all that kind of jazz. Right. Oh, okay. And that will continue to potentially, it could get worse if it's not.
Yeah.
Not treated.
Oh yeah.
Right.
Yeah.
Okay. And you, what other things do you do that maybe people don't know in terms of treatment? Because like you say, you do scar work. You've mentioned cranial psychotherapy. Maybe not, people watching this might not know what's meant when people talk about that.
Okay. Right.
Difficult one to explain this, isn't it?
It is difficult to explain with cranial psychotherapy, but I integrate my cranial psychotherapy into my work, into my myofascial work. They're similar, but it's about me really listening to the body. It's really listening to the body and not fixing it, but allowing the body to do what it needs to do to heal itself.
Right.
So sometimes I start off as a bodywork therapist. You know, I thought, all right, I'll do this, and this. But when I'm listening to the body, it just gives me a little bit of a kick and go, no, you need to stay here. Right. And it's just feeling through here. I can feel the denseness of the tissue, and I just stay there. So with cranial psychotherapy, it's just staying and listening, and it's also tuning into the sympathetic nervous system, which is your fight and flight.
Yeah.
All right. Which we've been a lot of since March. Everybody's been in, even though you think you're all right, you've been in fight and flight. And it's me tuning into that and just holding it, and then the body will just sort of release it. So then your parasympathetic nervous system will kick in, where your body will just go, and that's your rest and digest, is your parasympathetic nervous system. So with fascial work, that's the same, but it's I integrate it both. I really deeply listen to the body.
And I think that might be the thing that perhaps not everybody's aware of, is that when a client presents to you, it may not be one answer. So I suppose I'm maybe putting words into your mouth, but as I understand it, you are holistically understanding that client, and you may blend your specialisms depending upon what that client may need.
Yes. When clients come in and they talk to me, I'll say, okay, and I have this plan in my head. All right, before I touch a client. But then once I touch a client, you go, okay, I need to change this to this. Or, okay, no, that's not working. I need to bring this in. So I have a lot of tools in my toolbox that I just think, yeah. And I don't use the same thing that, you know, two clients can come in for the same condition, but I don't give them the same treatment.
Yeah.
It's different.
Yeah.
Because I'm listening to their bodies. Their bodies are telling me something different. So I have to, like, I don't give one treatment for, you know, for the 5 neck and shoulder problems.
Yes. Yeah.
It's all different.
Yeah.
It is very bespoke. Yeah.
So anyone who's watching this and may want to contact you or may want to book in, what does December look like for you? Have you got space to get people in?
I've got the space to get people in. I'm in the process of contacting the clients that I was seeing before the second lockdown. But give me a ring, and I'll see if I can fit you in. You know, yeah, let's get you sorted out before Christmas, then you can enjoy Christmas.
That's true, because some people may have been sat with something now for nearly 8 months.
Exactly.
So absolutely, people have been kind of, well, I don't want to go to a GP surgery, I'm not keen on going to the hospital.
Yeah, contact me, let's see what I can do, and let's see if we can get you a better Christmas than what you're feeling like now. You know, you can bend down and pick that fiver up off the floor.
So if somebody wants to contact you, what would be the best way? What's the preferred way to contact you?
I would prefer if you ring me. People do message me on Messenger or through my Facebook page. But yeah, just ring me. But if you do message me, please leave your number and then I can call you back. Because I really need to talk to you, because it takes me ages to write all. No, just ring.
Good old-fashioned phone call suits you fine. And if you can't answer, that's because you'll be in clinic and you will ring them back. That's right, isn't it?
Yeah, I'm starting back in clinic on Thursday next week. So even if I don't pick up, please leave a message and I will get back to you as soon as I can, because I'll probably either drive in or a client.
Super.
I'm not ignoring you. It's yeah, I'm busy.
Wonderful. Well, thank you very much for letting us ask you lots of questions. It was a pleasure to see you.
It's good to see you as well, Ruth. Thank you.
See you soon.
Bye.
Bye.